presents the ATXpansion on Politics 2012, the place where area growth and politics meet.
Welcome to the Long Center for the Performing Arts here in Austin. This is ATXpansion Leadership Austin on Politics 2012 Town Hall, a conversation about the issues facing you in this election season. Hello, I'm Robert Hadlock.
And I'm Leslie Rohde. Glad you're with us today. Now, we know we're less than a month away from the election, and you all know about the presidential race, I'm sure, but the decisions you'll be making on the local level will have the power to change the greater Austin area for years and decades to come. In this program, we'll take a closer look at some of the issues, multi-million-dollar issues, decisions on transportation, healthcare, housing. And then we'll go in depth with the help of our Leadership Austin panel of experts.
Those include Cheryl Cole, an Austin City Council member and Mayor Pro Tem.
Former council member and Mayor Pro Tem Betty Dunkerley also joins our panel.
Mike Clark Madison is the Vice President of Public Policy and Research for Hahn, Texas.
And Terry Mitchell is the President of Momark Development. Thanks to all of you for being here this morning. Let's go ahead and get started now with our topics. We have a lot to cover. In just a few weeks, voters here in Travis County will decide whether to pay more for health care. One item on the November ballot calls for a tax increase for the county's health care district.
Get you up to speed here. Right now, homeowners pay just under 8 cents per $100 of value on their homes. But if this proposal passes, the taxes would jump to nearly 13 cents. The average home here in Travis County is valued at more than $214,000. Taxes on that average home would go up more than $107 per year. And a lot of folks say that's simply too much tax money to pay. But as KXAN's Josh Hinkle shows us, supporters say the plan's cost is worth the benefits it will bring.
We're going to have to grow our own physicians here.
Austin is short on doctors. Ask Christopher Zebel, the head of ER at UMC Brackenridge. He sees people leaving town to get the care they need.
Right now, this community suffers from people of all walks of life having to go to Houston to go to MD Anderson for cancer care. They have to go places for advanced surgeries that aren't done here. Transplants, for example. People have to go to Dallas or San Antonio or Houston.
The answer? A medical school. The central health tax won't actually pay for the building, but it will pay for doctors, teachers, students, and their resources. Those things should spill into the community. As Zebel says, 80% of med students end up practicing within 50 miles of where they went to school and residency. For you, it will eventually mean health services like better preventative care, telemedicine for patients at home, and extended clinic hours.
People that are working folks that need to go to the clinics after work or on weekends, they'll have that available.
Senator Kirk Watson has been a driving force behind the tax, seeing the long-term health benefits and savings.
One of the biggest benefits for this is possibly to help the poorest and the underserved in our community.
No questions. We can save taxpayer dollars by reducing costly visits to the emergency rooms by enhancing and providing more accessible health care for our indigent population.
Zebel sees his ER fill up daily because many people have nowhere else to go for care, at least right now.
This isn't so much about paying another tax and getting nothing as it is about investing money so that you can get a really good return.
And that was Josh Hinkle reporting. Let's get the conversation started with our panel today. We're talking about $100 more per average family per year at a time when people are saying my taxes are enough. It's enough already. Is it worth the money, Betty Dunkerley?
Well, I certainly think it is. And as Chris said on the monitor, it's really an investment. That $100 a year is about $8 or $850 a month. And what do we get for that? And I think with the medical school, the new teaching hospital, and we'll get a more comprehensive and transformed healthcare delivery system. You know, Robert, there are about 200,000 people in Travis County that are uninsured, and about 60% of those are the working poor. They just can't afford health insurance. But with these dollars, we'll be able, as Senator Watson said, to expand the clinic hours. We'll be able to really take care of people in the most appropriate place at the most appropriate time and reduce the crowds that we see at all the local emergency rooms.
Councilmember Cole, how do you see this?
Well, I mean, there's just no question about our healthcare delivery system that it is not adequate, especially as it is to serve our indigent and aging population. So I believe that it really does complement what this city is anticipating doing on its bond election, which will not raise taxes. So I support the medical school.
Terry?
I think healthcare is a fundamental need in any community, and I think it's, if you're a businessman, it's a key to your economic health, to have employees be able to have medical care. I take it down to a personal level, and I have 2 sets of friends that are in Houston every 4 weeks for cancer treatments. And it just makes no sense to me that a metropolitan area of 1.8 million people can't treat their own here.
Mike, is it worth the tax increase? There is a need, but people say they're tapped out.
Well, we hear that, but Travis County voters have actually been pretty willing to raise their taxes before. We don't have, a long record of failed bond measures or tax initiatives. Travis County voters got together to create Central Health 7-8 years ago. So I'm not sure that, even though I know that that sentiment is out there, it would be new for it to actually manifest itself in a taxpayer revolt at the ballot box.
Betty, you want to jump in?
Well, a couple of things I'd like to add that haven't been touched on is that with this tax increase, we'll be able to have more mental health services for all of us, more outpatient mental health, more really if you're mentally ill as well as physically ill, we'll have some beds in the new teaching hospital to accommodate those patients. There are times, it doesn't matter whether you have insurance or not, that you can't get adequate mental health care in this community because it's just not available. And so I think that's one really big deal. And the other thing that the medical school does is create a pipeline for physicians. And the people my age, that's over 65, and people between 50 and 64 are the 2 fastest growing segments of our population. And if in 4 or 5 years we're going to be short over 700 doctors in this community, with the trend being that the aging are growing a larger percentage of the population that access health care more, we're going to be in a world of hurt if we don't do something strategically to make sure there are doctors available in our community who are willing to treat everybody, including the elderly.
Do you think voters really have an idea of what they're voting for in this? I mean, we've got federal health care reform still going on. We've got so many other, I think voters may get a little confused with what they're voting for. Do you think supporters of this have done a good job in educating the voters on this?
Well, we're certainly trying. And I do think it's a complicated issue. There's a medical school that UT is going to build. There's a teaching hospital that Seton's going to build. And there's an enhanced healthcare delivery system that will be improved with all of the providers in the community. So it is complicated. But when you look at things like cutting edge medical care, complex transplants, complex cancer treatment, the mental health component, and treating those folks that don't have insurance at the right place at the right time, so it gets a little complicated, but I do think that it is truly an investment in this community, and I hope it's one that we're willing to make.